Hi, and welcome to the Mom and Mind podcast. I'm your host, Dr. Kat, and on this episode, I am joined by Rachelle Dumas. She is a registered nurse, a maternal mental health advocate, and founder of A Light After 9, a nonprofit dedicated to supporting families navigating infertility, pregnancy loss, and maternal trauma. Drawing from her own experiences with 9 pregnancy losses and systemic disparities in maternal health care, Rachelle uses her voice to advocate for trauma-informed, equitable care. Through her nonprofit, she provides emotional support, resources, and education to empower families and drive systemic change in maternal health practices. And Rachelle is sharing her journey with us into motherhood, gave her the strength to keep trying to have another baby after experiencing 9 pregnancy losses, and what it was like to have a baby after that many losses, how she cared for her mental health, and what advice she has for other people going through multiple pregnancy losses. And as she talks about a lot of people's experience in how the US healthcare system sometimes fails pregnant women and especially Black women. All of the things she's experienced has led her to create her nonprofit, A Light After 9. And so we get to hear about the amazing work she's doing in the world. So let's dive in and meet Rachelle. Welcome, Rachelle. Thank you so much for being here.
Thank you for having me, Dr. K.
I love the work that you're doing, and I want people to know more about it. And I would also love for people to understand how you came to be doing the work that you're doing. So if you'd like to start there, wherever feels right to you.
Yeah, absolutely. I think it's hard to talk about the work I'm doing without first sharing my pregnancy story, what led to it. So I'll be happy to get into that first.
Okay, great. Yeah, wherever it starts.
Yeah, absolutely. So in 2018, I got my first home positive pregnancy test, and I went to the OB because I was bleeding, and I got a transvaginal ultrasound done and was told that I was having a miscarriage. And despite of this being my first pregnancy, it was also my first miscarriage. And I didn't know too much about it. While I'm a nurse, I was a trauma nurse at the time. I knew how to save lives. That's about all I knew with maternal health. And I was reassured by the OB that I would go on to have healthy pregnancies and that this is just a part of the journey. And I believed him.
Oh.
I went on to 2020 and I did a travel assignment in New York, came home, and I got pregnant, and I was at work in the OR this time, and I had bleeding. So I went to the ER nearby, and I was told that I had twins.
Oh, how far along were you?
And I was about 7 weeks,
Okay.
7 weeks, and I was early. And he said that the bleeding seemed to be caused by what's called a subchorionic hemorrhage, which is when your babies are implanting in the uterus, it can cause a sac of blood. And typically in a pregnancy, it's reabsorbed by the body and you go on to have a healthy pregnancy, but that's not always the case, but it is most times. By the time I follow up with the OB a few days later, I had excruciating 10 out of 10 pain and vomiting, nausea, and worsening bleeding. And the OB did a vaginal ultrasound and did the other basic testing for pregnancy and said everything was fine. But my symptoms were horrible, and I was in and out of the ER and in and out of the OB's office quite frequently, maybe 2 or 3 times a week. It was so bad. And I kept being sent home and told that nothing was wrong. At 13 weeks and 3 days, I had my first loss. I lost my first baby. And all my symptoms went away and I felt great. But at 15 weeks, despite of being reassured again, I woke up wet this time. And with the lack of education, I assumed that I urinated on myself while I was asleep. That was the day of my gender reveal. And right as everybody came over, I went to use the bathroom and the baby fell out in the toilet.
Oh, no.
And I was devastated.
It's heartbreaking.
I was devastated as I picked myself up and I called my husband who was out getting something. We went to the ER, the same ER I had been to probably 10 or 15 times throughout this pregnancy alone. And I told the doctor that I lost my second baby at 15 and I'm 15 weeks in a few days. And she asked, "How do you even know that you were pregnant?"
What? Oh Okay.
And I said, would you like to see? Right. And I'm like, do you want to see a picture of the baby? And she said, yes. And I showed her.
You kidding?
And I showed her, and she said, oh, that's a baby. I said, oh, yeah, that's a baby.
Wow. The nerve. Oh my gosh.
After that experience, I followed up with the OB, and she diagnosed me with cervical insufficiency.
Uh-huh.
So when the baby gets heavy enough, typically around the end of the first trimester, beginning of the second, the cervix opens because the baby is too heavy for your weak cervix to carry full term.
Uh-huh.
And the treatment is a cervical cerclage. I had to wait till 13 weeks to get that done. The other issue is that I was having early pregnancy losses. I had a few after that. And a friend of mine was like, you should go to my sister's OB clinic. She said she would love to help you. And I did. And she put me on progesterone. And she said, take this as soon as you get a positive pregnancy test. Like, test early. You don't have trouble getting pregnant. Obviously, I had 5 losses at this point. So I got pregnant that April, and I immediately started the progesterone suppositories. And then a manager of mine was like, you need to see a specialist. Like, you have 5 losses. She said, you need to go to a reproductive endocrinologist and a reproductive geneticist, see what's going on. And I did. There was no genetic component seemingly to the losses, despite of my mother having 2 stillbirths and an aunt of mine having 7.
Okay. Oh, wow.
So I went to a reproductive endocrinologist. She was very thorough, like one of my favorite doctors throughout this journey. And she did all types of testing for autoimmune diseases, thyroid, genetic testing as well, and anatomy of my uterus, just to see if there was any issues anatomically causing these losses. I didn't finish all of the testing because I got pregnant. And she followed me throughout my first trimester, put me on aspirin as well. And then I graduated to a maternal fetal medicine doctor. That was the first time I had any interactions with specialists.
But you should have had long before that.
Long before. This was pregnancy 6.
Yeah. Okay. All right.
So I finally made it to 13 weeks. The maternal fetal medicine doctor put in a transvaginal cerclage, which is the only cerclage that I was told about at the time. And she said, come back in 7 weeks. Now, I've had 5 losses.
7 weeks?
7 weeks. I've had 5 losses at this point.
Oh my gosh.
So I'm advocating. I'm like, I think I should come back just a little sooner because I've had 5 losses, at least 2 weeks out. And I'm an OR nurse. We always have people follow up within 7 days, 2 weeks. So I thought that was very weird. But she reassured me that if the cerclage was failing, you will have excruciating pain and you will have bleeding. So I'm like, okay. In my mind, rationalize it. If a suture is like ripping through my cervix, yes, that seems like that should happen. Okay, I'll monitor it. I'm hyper vigilant right now, so I'll monitor it.
Of course.
7 weeks pass, and I feel phenomenal. I'm walking to the office like ready for my 3D ultrasound, my rite of passage. This is the longest I've been pregnant. I feel great. I'm planning my baby shower, and mid ultrasound, the ultrasound tech just walks out. And the doctor is going to come back in. And I immediately turned to my husband like, this is the end. So this is bad. And he's confused. Like, what? She just said the doctor's coming. I was like, no. No. And you know how it is. Yeah. No. Not the way she said it. And sure enough, the maternal fetal medicine doctor comes in and says, your cerclage failed.
Oh my gosh.
So I'm flabbergasted because I was waiting on the fireworks of the failure.
Yep. Oh, sure.
Every day I'm like deeply assessing my body, meditating to see if I feel something deeply inside of me that I'm missing. And there was no symptom. And I said that to her. I said, you said that I would have bleeding and severe pain. And what happened to that? I feel great. Even right now, as you're telling me it failed, I feel great. And she said, yes, it failed. I'm sorry. She's just apologizing, barely. She's just apologizing for that I didn't feel anything and it failed.
And that's the doctor who said you would feel.
Right. And I'm like, so we have to do something. Can we please put me on bed rest? Can I stay in a hospital room? Can you do another type of surprise? Can it be higher? And she's no, but you can go and deliver the baby.
I'm sorry. Oh, okay. How many weeks are you again?
I'm 20 weeks and some change. And I say, when the baby dies, we're only 20 weeks. She said, yes, at this gestational age, the baby will die. And I say, there's no,
That's the option she gave you
that's
is
the
to
only
deliver.
option. Disregarding any advocacy, disregarding any questions about any other options, you can go and do that. And assure me that the baby would die.
What?
And the baby has a heartbeat. Baby is perfectly fine. I just watched him dancing around in my belly, like literally minutes ago.
What?
So I said, oh, I'm not doing that. I'm enraged at this point. I have a
For
very calm rage. I'm like, oh, I'm not doing that. I'm leaving. Do not talk to me. Goodbye. And I leave. And I'm like hysterical. And I call myself down. I'm like, okay, I need help. Like, I need to call my village. I need to call every doctor, every nurse, every healthcare provider, every friend, family,
Yes.
the man on the corner. We need
Right.
to all come together and
Right.
figure this out. So I'm doing research simultaneously while telling everybody what's happening. And I found out that you can do a transabdominal cerclage to try and save a failed vaginal cerclage. I saw like some research done on some birthers who have had this, and we found this doctor in Dallas, Dr. Falwell at Texas Health, who is a godsend. And he's called me on his phone. He was like, I need you to get to Dallas. We're going to do this. He saved a prior pregnancy where there was a failed cerclage and they were twins. So I was like, I just had one baby. So, maybe this will be a little easier for him.
Right.
And I said, yeah, I'll make my husband drive to Dallas from Atlanta. He said, no, I need you to fly.
Oh.
And I'm like, oh, okay. So
Get here right now.
yeah, right now. I was like, oh, okay. Yeah, I'll just give birth on the plane. No worries. Sure.
Yeah, that's scary.
It's scary. I get on a plane, a red eye to Dallas, and he rolled out the red carpet. This is what he does. He literally does this. Like from security to nurses to everybody knew who I was. They knew, protecting HIPAA, of course, but they knew I was there for surgery out of the state and coming to see Dr. Falwell.
Wow.
That 3-hour surgery took 8 hours. I was on a plane. The baby was coming out, and he had to push the baby back in. He called in reinforcements, his counterpart, Dr. Tashard, and they got that cerclage in there. I could feel it.
That's amazing.
Yeah, they got it in there, and I woke up to everybody just celebrating. We're still pregnant. Yes, you're pregnant. We're pregnant. And unfortunately, after the anesthesia wore off, the contractions set in, and they gave me every type of medicine, tocolytic, everything to try to stop it. But for 30 hours, I was in labor. Oh. And at the end, my water broke, and I had to go back to the OR, remove both of those cerclages, get an epidural, and give birth at 21 weeks.
Oh my
gosh. And I lost that baby. But before this even happened, he said, if this doesn't work, I'm going to bring you back, and we're going to put in that transabdominal cerclage outside of pregnancy. And you're going to be a mom. And I said, okay. Dr. Farwell says he's the only doctor I believe that will tell me I'm going to be a mom, which I already was. To do all that, I already got that already. Yeah, I got the accolade.
Yep.
And I had some early miscarriages, had my gallbladder removed. Then yes, because after all those, but he brought me back that November and did the surgery, fully evaluated my uterus, made sure everything was fine, gave me some antibiotics just in case there was some underlying infection. And May of 2022, I got a home positive pregnancy test, was followed by the reproductive endocrinologist, graduated to a different maternal fetal medicine doctor there in Atlanta. I made it to the third trimester. And on 12/30/2022, I gave birth to a 4-pound, 15-ounce little boy who is now a 2-year-old who barely speaks English and has a pot belly and just gives me orders all
day. Amazing. Oh my gosh. From how many years were you in this journey?
From 2018, that's when I had my first pregnancy loss, to
Okay.
birth was 2022, December 30th.
So it's a total of 9 losses during that time.
9 losses, 8 miscarriages, and a stillbirth.
So and what I'm imagining is you're going through it. How do you keep going? What helped you to continue in this process? Because this is a lot of heavy emotional stuff.
Heavy. So there are quite a few catalysts. The doctors, right? So this doctor is saying you haven't tried this. This doctor is saying you haven't tried this. Oh, we haven't gotten this diagnosis. So now we have a diagnosis. Then we have a treatment plan. But you haven't seen this specialist. Now we saw this specialist. Now we have to make it to 13 weeks for this cerclage. Oh, there is a different type of cerclage you should have had all along. We're going to put that in to say this pregnancy. Oh, well, we're going to put it in outside of pregnancy. Pregnancy loss 8, 7, 8. I just wanted to make it to the second trimester with the transabdominal cerclage, the second one that he put in outside of pregnancy, to see if I'm able to carry full term. Right. So it was that. And then it was my therapist that I was seeing every week. And it was my urge to be a mom.
Right. And that's strong.
Yeah.
I know a lot of people who've had a lot of loss, and it takes a huge emotional toll.
It does.
And to gear yourself up to start again and try again and do all the treatments and the whatever like medications you have to take to support the process and doctor's appointment. It takes a lot of time, a ton of time.
Yes.
Just out of your daily routine, appointments and all this, everything.
A lot.
Energy, all of it.
Yes, it's a full-time job for me not to get pregnant, but to stay pregnant. It's an additional job.
So the therapist that you had, did they understand like what you were going through, or it sounds like how to support you?
Absolutely. My therapist, she's amazing. I still see her every Thursday. That's awesome. And I also tried hypnotherapy right before I got pregnant with my son, because I had, truthfully, I had given up. I was just like, okay, I'm done. But I hadn't used that last cerclage to even see if I could sustain a pregnancy. So I was like done, but I didn't need a push to help me. So the hypnotherapy was just what I needed. I loved it.
That's amazing. That's amazing. Because I'm going to make another assumption that there's a lot of trauma in all of this.
Yeah.
And of course, grief. But yeah, it makes sense at some point you're just tapped out.
Yes, 100%. Yeah.
Okay, that's amazing to hear that you found supportive therapy. And for a lot of people, that's the thing that helps the mental and emotional part of it.
Sure.
You have a place to talk about stuff, process through it, get skills, or whatever it is that you need.
Yes. Yeah, I wouldn't have survived that journey, to say the least, without going to therapy. I'm not sure how anyone does it at this point, just life, because there's so much going on. I don't know how people just are out here just living without like therapy, to be honest.
Well, yeah,
I commend you if you're able to do it, because I can't.
I actually think it takes a lot of strength to get to therapy. In some ways, we're told that we're just supposed to be strong and carry on and whatever, and that somehow or another asking for support is some form of weakness, which I don't believe at all.
And taboo times. And I think it also takes a lot of strength to stay in therapy. People love to start it and then they have the first tough conversation. Oh no, absolutely not.
You're 100% right.
Yeah, she's trying to get in my business. Oh no, I ain't come here for that. What are you coming for? Yeah,
that's right. So what are like some of the factors that contributed to the difficulty outside of obviously the losses itself? For one, I know some of the healthcare professionals that I meet with who are coming in for therapy, like they know too much. And that is part of what makes it hard. It's hard to not know enough, but it's also hard to know a lot about medical stuff. Was that a part of it for you?
No, I think it was not knowing enough, because despite us being a nurse, a medical professional, you don't know everything about healthcare and all the different specialties. You do not know. like I said, throughout my pregnancy journey, I was in trauma. I was in ICU, OR, some education, but I was not in maternal health. And that is a whole different, just different specialty
Right.
of medicine. And which is the reason why you have cardiologists and
Right.
pulmonologists and OBGYNs and neonatologists. That's why you have these specialties, because it requires specialized education for that patient population. So going in, I was so ignorant by definition
Oh.
of different issues within maternal health that I was actually facing. I didn't know what a cervical cerclage was. I didn't know what cervical insufficiency was.
Right.
I did not know what a maternal fetal medicine specialist was, or that it existed, or that a reproductive endocrinologist was a thing. I definitely know what an endocrinologist is,
Right.
for sure. But those set of doctors that I depended on desperately and needed, I had no knowledge about until someone told me about that. And it wasn't even my primary OB who said to go to these doctors that I so desperately needed. And even going to them, they're like, why didn't you come to us sooner? Because I didn't know who you were.
So that is, what do you think are the components of that, like in terms of the healthcare system? What, yeah.
Yeah, I think a lack of education is it's such a big issue within healthcare. It can be, in my cases, one of the leading causes of death, right? Because you as the patient has to know what's going on with your body and what you need. And if you do not know that, you're not going to seek help. You're not going to seek help.
Right.
Whether it's because of financial issues and you don't know about resources, you're not going to the doctor, or because you're in a maternal health desert and you don't know how to get to the doctor that you need. Or if you're like me, who you are a healthcare provider, but you are not in the specialty in which you are having issues in, then you don't know the different
Right.
specialists. There's so many layers of that, and education at the end of the day is what it comes down to, or a lack thereof.
Are there any parts of your experience that you contribute to you being a Black woman in this medical system?
I just want to say that Black women are 3 to 4 times more likely to die of preventable pregnancy complications than our white counterparts. And there are so many reasons why. One is medical gaslighting. There are so many times we go in and we're like, these are my symptoms. I'm having pain. I'm having blurred vision. My head is feeling like it's about to just blow off. It's the worst headache of my life. And we're told that's not what's going on. And we're sent home and we die. Or we get sicker. We have delayed treatment. We have delayed diagnosis, which leads to delayed treatment. And just an example of this is my twin loss. I kept having bleeding. I had 10 out of 10 pain. I felt like I was in labor for probably about 12. I was 6, 7 weeks when I found out. So about 5 weeks, I felt like I was just in labor. And I was sent home so many times and told that everything was fine. Never referred to a specialist, only to lose 2 babies. There was times I went to the ER because my cardiologist sent me because I was diagnosed with POTS during my last pregnancy. So anytime I was vertical, my heart rate was in the 180s and my oxygen was dipping to the 80s. I could not breathe. Only for an ER doctor to make me walk around with a blood pressure cuff and a pulse ox to check my symptoms. Only for her to see those symptoms and to document it that I was completely fine.
Oh.
Which, as we know as healthcare professionals, if a doctor documents something, we're big on continuity of care. So if she says this is what it is, I'm going to go up on her word and then steer my treatment based off that. Correct. So because of that, my child could have had a anoxic brain injury. I could have lost my life. We don't know what was going on. It wasn't until I went to the maternity triage where she just cast me off that I met with the OB that was on call, requested a pulmonology consult, just to advocate in me and also the nurse in me, not saying no, and made them watch me walk around with a pulse ox and a blood pressure cuff and show them my symptoms. And the pulmonologist ordered oxygen. But if they had listened to her, then nothing was wrong with me. But the pulmonologist said you need oxygen because if it stays in the 80s, your oxygen stays in the 80s, you have to have a C-section in 10 minutes.
Oh, wow. You're also having to be vigilant about your own care and advocating for yourself. And it's really hard when you're in a vulnerable position like you've been to
Right,
also have to like that's a very difficult emotional space to be already, but then to have to override that and just try and think is sometimes
right,
really hard. Like
right,
what do you actually need? And you want to believe that everything's fine. Of
right.
course you want to believe everything's.
Mid-crisis.
Yeah. Yeah.
Mid-crisis, I have to advocate for myself. I have to, figure out what's going on with me because the doctors are dismissing me.
Right.
I have to do research. I have to go through the emotions I'm going through because I'm in a crisis. And
Mhm.
I'm taking care of two patients just like they are, me and my baby.
All of this that you've been through for years, and then you get to that point where you finally get to meet your baby boy.
Yes.
What was that like for you?
Arriving to the hospital and just leading up to the C-section, I was joking with the anesthesia team that whole time, and I told them, I'm gonna be honest with you. If it's an alien that comes out of me, I wouldn't be surprised. I would believe that before you say that was
Uh-huh.
happening. And they're like crying, laughing. I'm like, I'm so serious. I understand that I'm pregnant, but am I though? Like, am I really
Right.
like about to give birth? So is that I don't know if that follows. That looks like. But once he came out, I was still in shock. I was still in shock. And unfortunately, the pregnancy loss just interrupted our bonding.
Yeah.
I was very aware that I was a mom and now a parent, and that I had a baby to take care of. But the pregnancy journey would not allow me to believe that I had given birth. And then the fact that he was whisked away to NICU and I didn't see him for 12 hours was like, so I really did I give birth? Like I was even questioning that, what just happened? So
Like it's surreal, kind of
it was
really.
so surreal.
Uh-huh.
It was.
Uh-huh.
And even when I went down to the ER to see him, I was just like, is he mine? Are we sure? Like this, and that went on for a month. I was just like, I just knew he was gonna leave. I just knew he was gonna die. I was in therapy every week, and I'm like telling my doctor, I just don't believe he's gonna stay. Like, why would he stay? Like everybody, all the other babies left, and I had to force myself and be intentional about accepting him as like someone who was going to stay. My baby that was mine. I didn't call him his name or say my baby or show any ownership at all for that whole month.
Right.
He was my patient and I was his nurse. That was our relationship. I would hug him and kiss him and stuff, but that bond that many moms feel when they first see the baby or throughout pregnancy, I didn't experience that till a month after birth.
It makes sense, everything that you're saying. It's hard to believe that. It would be hard to believe, especially after all of that trauma.
Yeah, for sure.
So, at what point did you decide to do the work that you're doing with the Light After Nine?
Yeah, so I took a year and 8 month hiatus from pregnancy just to I use the word rest with caution because who is gonna rest for the baby? Do you rest? Is it like when they go to college? It's like when the
Someday.
right? So I know someday eventually, but I took a hiatus of from pregnancy. I would
Yeah.
say that and during my solitude, I was like, I don't want other people to go through what I went through. I created a light after nine, and I called it that because my light is my son, and also the light is being on the other side of all the grief and the uncertainty in that journey. And I wanted to give moms, birthers, all of the resources that I wish I had. Finding doctors for them, following up at the appointments to make sure they had the specialists and everybody that they should be seeing. Mom to Mom mentorship program to make sure if you've been there, done that on your pregnancy journey, that you can help another mom who's who needs to be shown that light, because it's a dark journey sometimes. And I also help vet providers for them and make sure they're high quality.
Nice.
We find mental health resources and grants because it's expensive.
Right.
I should be driving a Bugatti at this point, but it's going to the hospital. I'm still paying all these bills. So it's expensive. And then business to business, we work with hospitals and we're working with clinics to help reform their maternal health programs. And I'm working with a hospital that I had all the trauma at right now, actually. And yeah, I told them my story and they were in tears.
Yeah.
I talked to the CNO and the CEO. I talked to their execs and they were like, wow. And so working with them.
Powerful.
Yeah. So we do palliative care, perinatal palliative care, perinatal supportive care for our high-risk moms who are not at risk for losing a baby, but they need that support along their pregnancy journey and that advocacy that they cannot do themselves because of education, because they're going through crisis, because of a lot of things. And also perinatal palliative care, because we face fetal demise, but palliative care is not consulted. That is insane. That is insane. And we also do post-discharge case management because they're just discharged and told to follow up with the OB. When in actuality, they probably need a cardiologist and a hematologist and a neonatologist, but nobody's telling them this. And if they're like me, a friend or a manager will have to tell them to see a specialist that they know nothing about after 5 pregnancy losses. That is insane. Yes, we do all of those, and we work with moms, villages, and hospitals, healthcare providers. In addition to, I speak at quite a few festivals and conferences and podcasts, just so I can get the word out, and also educate our healthcare providers on what culturally competent and just safe perinatal care looks like.
That's amazing. As you were describing all the things you're doing, it's just like you're filling so many gaps and so much need in so many areas, and not to overstate it, but because there are so many gaps too, it looks like you, through your own experience and probably what you're hearing from a lot of other people, are really able to see where providers are missing the mark, where their resources aren't enough, and getting people to that support.
Absolutely. Specifically, when I present, I have turned my pregnancy journey into an interactive case study. So while I'm presenting each pregnancy and giving a scenario to healthcare providers, they're able to use a QR code that they scan on a presentation to vote for which care option should have been used.
Super cool.
Right. In real time, you can see the balls that were dropped, the maternal health disparities, inequalities, all of it in real time, case by case, pregnancy by pregnancy.
Oh, that's awesome. Wow, that's a fantastic use of technology.
Thank you.
That's really cool. And that's such a good way for people to learn too, because man, if you're choosing the next option and it's the right one or the wrong one, then you've learned something in that moment.
Right. You've learned it. So it's really good. I love presenting. I love speaking. I love conferences. I love doing that because it also keeps them engaged. Have you ever just been to a conference and it's just like you're falling asleep?
Yes. Yeah.
That doesn't happen when I present.
That's awesome. That's awesome. And it's so needed, clearly. Rachelle, thank you so much for sharing your story and for the work that you're doing to help other people. I just, like I said before, I think it's so important, the work that you're doing, and it's inspiring as well.
Thank you so much. I appreciate it.
Please find Rachelle and her resources at alightafter9.org. She's also on YouTube, LinkedIn, Threads, TikTok, Instagram, and Facebook. So please go check her out on those platforms. And if you haven't yet followed Mom and Mine on Instagram or Threads or TikTok or Facebook or YouTube or all of the same places that Rachelle's at, definitely check us out there. So you can follow along and get each and every episode downloaded directly to you when it comes out. And that is every Monday and every other Thursday. Thank you so much for joining us today. Until next time.